Of teenagers should be especially worried. This trend has been increasing since the pandemic began, and young people are susceptible to opioid addiction and overdose, unfortunately. So joining us now is Dr. Andrea Raby with Bayless Integrated Healthcare to talk more about the pandemic and how it can amplify addiction. Good morning to you.
Good morning. Thank you for having me, Etta.
Thank you for being here. I have to ask you first off, why are teenagers especially victim to this opioid use during the pandemic especially?
Right. I mean, that's a great question. And I think that, it's something that really needs to be addressed. These are children, these are adolescents, and even what I call pre-COVID or prior to COVID manifesting in March of this year, it's always a challenging time for our teenagers. It's a period of identity, developing a sense of self, and really finding out who we are during this vulnerable period of time. So when you add COVID and all the stressors with COVID on top of that, certainly that we've all experienced, but of course with our adolescent population even more magnified, then you can have so many more consequences along with that with our adolescents. Meaning overdoses and relapses on opioids.
And what age group are we talking about? Are we talking about the older adolescents or the school-age kids, younger 14, 15-year-olds?
Yeah, another good question is where does that lie exactly? And really what we see is it runs the gamut, unfortunately. We do see with our inpatient population in some facilities a higher rate of opioid-related overdoses and overuse with the 18 and 19-year-olds. But certainly, and unfortunately, our younger children are also experiencing this as well.
That is so hard to hear. Now, I have to ask, are there any new forms of opioids that are especially harmful? What should we be looking out for and paying more attention to as parents?
Yes, yeah. And even more concerning is the sort of synthetic, if you will, opiates that we see. These synthetic opiates, meaning fentanyl, can even be more deadly for various reasons. Number one, fentanyl is 50 times more potent than heroin, 100 times more potent than morphine. And on top of that, some of our children or adolescents are using different types of drugs, such as Xanax or alprazolam, and they don't know that these types of medications are actually laced with fentanyl or other forms of opiates. So this is even more deadly than we can even imagine.
Oh, for sure. And I'm sure a lot of people are listening to this going, not my teenager, not my kids. So how do you talk to your teens before they go down that road, or even spot if they are the ones who actually need help?
Right. In thinking about this and in seeing, unfortunately, so many people affected by this, really the word that comes to mind is prevention, and that's the key word. And open and honest communication is so important. If you suspect that your child is showing signs of change or changes in behavior, which can be confusing with COVID because we've all experienced change in our routine. But if you sense that something's different in their schedule, their routine, their selection of friends, and open and honest communication and education in regards to opiate use and the dangers of opiate use is first and foremost, for sure.
Dr. Raby, that is excellent information for parents out there who have teenagers. Thank you so much for joining us this morning.
Absolutely. You're very welcome. Thank you.
Thank you, and be safe.